Maternal Mortality in the United States, presented by Isaac Arden-Amissah. Maternal mortality is still prevalent in the United States, with high prevalence existing in rural and poor communities of minorities. There are rising numbers of maternal mortality, and these are due to demographic factors and relevant clinical manifestations. Low socioeconomic status and lack of access to better health care before, during, and after pregnancy. Excuse me. Maternal mortality is prevalent in the entire United States population, but the most prevalence of disease risk and mortality are seen in the rural areas of the United States, in poor communities with significant health disparities. All women are at risk, but ethnic minority women with low socioeconomic status, thus low-income earners, and also located at rural areas are most impacted. There's a high chance of dying for being a non-Hispanic Black woman, with a ratio of 3:1, and that is a huge health and racial disparity. 56.3 deaths per 100,000 live births for non-Hispanic Black women, as compared to 20.3 deaths per 100,000 live births for Caucasian women. Yeah, that's a ratio of 3:1. Prevalence of maternal mortality in the U.S. is immensely impacted by social determinants of health. Excuse me. Demographic factors and the relevant clinical characteristics. These are seen in minority populations such as African American women. There are some high prevalence of obesity, diabetes, and hypertension, which are seriously risk factors for preeclampsia and also heart disease. Low socioeconomic status affects financial freedom and choices in health decisions. Lack of access to better health care before, during, and after pregnancy is also a big issue with maternal mortality contributory factors. Non-coverage by insurance can definitely affect how women decide to access health or not. Now let's look at the description of the issue of maternal mortality using the socio-ecological model. This model has 5 stages or levels: individual, interpersonal, organizational, community level, and policy level. We're looking at 2 factors here, factors that help with the reduction and then the factors that hinder the reduction of maternal mortality rates. Education is one helpful factor that we're going to use with this model. Knowledge gained helps to improve the belief system of individuals, which definitely goes a long way to improve their health behavior and their choices, definitely impacting their choices with health decisions, and that impacts maternal mortality rate reduction. Cultural belief system is another factor that hinders the maternal mortality reduction efforts. The other factor or point I want to look at is access to healthcare in minority groups for pre and postnatal visits. And that is a helpful factor on the interpersonal level. And also we look at the absence of social networks in minority groups. And this is a big issue because of the limited resources for the most part for low socioeconomic status populations. And that definitely affects the maternal mortality rates reduction efforts. At the organizational level, creation of reliably effective health systems in at-risk communities impacts their reduction efforts. It improves it, it helps to improve it. Negligence of at-risk communities at the organizational level hinders the reduction efforts of maternal mortality. Community level, we look at improving awareness efforts through the use of NGOs, coalition groups, media, etc. helps reduce maternal mortality. On the other hand, not improving the low SES issue will hinder improvement efforts despite awareness campaigns. On the policy level, insurance coverage is very vital. Therefore, it's very important for reforms by the government and all associated entities to help make the healthcare policy better for insurance coverage, which will help people to better access health. Non-coverage, on the other hand, impacts efforts negatively. Now we look at proposed interventions. Insurance coverage, as talked about earlier, is one of the factors. Preventing hypertensive complications from preeclampsia, which leads to eclampsia, also goes a long way to improve the problem of maternal mortality. And access to care increases maternal survival rates since pregnant women are able to be seen by healthcare providers and complicated issues are seen, such as postpartum hemorrhage. Not only that, but also the absence of labor attendant at delivery. For the most part, that people are or areas that do not have access to healthcare. Now, this is detail for the proposed intervention for insurance. Promotion efforts lead to the development of better health insurance coverage. As talked about previously, campaign to enhance better funding as well as campaign for better access to healthcare providers is a vital factor that helps to reduce maternal mortality, especially in minority groups with low SES, before, during, and after pregnancy. Another intervention with a reduction in risk behaviors. This is basically going to go back to the factor or the point that we talked about with preeclampsia and eclampsia. So, pre-existing conditions or diseases that most of these low SES populations have, such as hypertension, contributes to preeclampsia. So looking at reducing that problem will help to avoid the progression into eclampsia, which is very fatal. Better access to healthcare also helps to detect some of the complications associated with pregnancy, such as postpartum hemorrhage. Educating and advising pregnant women to access health facilities and effective intervention that reduces mortality rates as there is a presence of a skilled labor attendant during delivery. Proposed evaluation. Process measure, impact measure, and outcome measure are the three levels of evaluation that we'll be using for these interventions proposed. Using the insurance coverage as an example, the process measure here will evaluate this. Have the campaign efforts to advocate for improved Affordable Care Act coverage in low SES communities being tested. Data collection is questionnaire assessment from the team. Impact measure, survey and measure the number of pregnant women who are now able to access healthcare services without the burden of insurance coverage and high cost of health services. Hospital healthcare, health center records and questionnaire will be used for data collection. Have there been improvement in health insurance coverage for the underinsured and uninsured? And that's the outcome measure. The data collection is from open-ended questionnaire. Potential challenges and barriers to intervention implementation. Insufficient resources for campaigns is one challenge, and it's going to be potentially solved by fundraisers and soliciting for help from benevolent partners. Limited number of volunteers to serve with education and advocacy efforts and capacity building efforts in rural areas of ethnic minorities will also be potentially solved by fostering collaborative partnership with community authorities to help recruit local volunteers from communities and also involving stakeholders. This is a logic model, and it basically lists the inputs, and these are the stakeholders. Activities here are listing the efforts that are put in place. It's mostly with knowledge and education, and outputs is showing the result, and the outcomes showing the expected changes towards health behavior of maternal mortality. Impact is showing a long-term reduction maternal mortality.